Hi everyone, welcome to this conversation that I'm having with my lovely and wonderful guest Dominic, who I'll invite to introduce himself in a moment. My name is Sally Desborough. I'm the founder of Your Wellbeing Hub. We are a training organisation that specialises in mental health and wellbeing. So I'm a mental health first aid instructor, suicide first aid instructor, do a lot about workplace resilience and wellbeing. Anything in the mental health arena, kind of training is my thing. Dominic and I thought it'd be great to get together to chat for 15, 20 minutes or so about what's happening in society, what mental health is looking like, and how we might be able to support ourselves and one another. But before I continue, Dominic, can I come to you for your introduction, please?
Certainly. Thank you so much. It's wonderful to be here to be a guest on your show. So I run positive change programs involving hypnotherapy and breathwork to help clients reduce, remove anxieties, PTSD, and I work with addiction successfully as well. I'm based in the Midlands, working with individuals and some companies. Okay. Can I start with a question? Is that okay, Sally?
Yeah, of course. Far away.
So we've all seen the news, unfortunately, at times.
Mm-hmm.
What do you think of the current landscape in the UK around poor mental health? What do you think is happening at the moment?
Oh, I mean, it's a really good question. And I think there is a lot to be worried about. And, talking about the news and mentioning the news, I have to say I limit myself to the news because I know that just causes me loads of stress and anxiety. But, anecdotally, ultimately on the ground, I'm always reading about research reports. I'm running mental health and wellbeing programs. People share their stories with me and the landscape isn't looking good. More and more people are experiencing poor mental health, which I think is understandable given the societal issues that we're facing locally, globally. So, the poor mental health is certainly increasing. It's becoming more severe. The suicide rates aren't changing. So with all the training, the raising awareness, the prevention, the suicide rates aren't really changing. So I think back to 2022 in kind of Great Britain, more than 6,400 people died by suicide that year in Great Britain. So, it's not changing. It's not moving. People are feeling more stress, more anxiety, more burnout. And unfortunately, that is the reality of the situation. So I think there continues to be more of a need for help and support and access to services.
Definitely. And it's dreadful, isn't it, to understand that, people are taking their own lives. I do believe, though, in 2021, I'm not sure, should we say, which party was in charge, but I do believe they said they were going to inject around £500 million into this country to train people up, talking therapies, etc., to help with poor mental health. I'm not sure, how that's going or whether you've noticed in your professional arena whether anything's changed. What do you think?
Yeah, so I think you're right. In 2021, this announcement was made to recognise the mental health challenges that lockdowns and such kind of, resulted in. Has much changed? I don't know if it has, anecdotally, again, on the ground, when people are sharing their stories with me in learning sessions or when I'm having, one-to-one coaching sessions with people, more and more people are struggling to access services. So yes, this £500 million was promised, but I don't know if it's happening. I don't know over the period of time. I don't know what is going on, but I know certainly people are talking about, child and adolescent mental health services. You try and call their number and their number doesn't even ring. They've kind of shut down or they've shut their waiting list off. So, children and young people are trying to access support. It's really hard to do that. I read recently a story on LinkedIn where somebody's still trying to wait for an appointment through their local mental health services team, and they received a letter. It's been 18 months or something.
Oh my gosh.
Received a letter, and essentially it said, "Sorry, we still can't offer you an appointment. If you're feeling suicidal, call the Samaritans." And that's what the letter said.
And that's what we don't want to hear. We're here to provide support for people, to help people, if they pick up on our conversation here, and we can give some tips a little bit later on, that's going to help, the masses, hopefully. And just picked up when you mentioned about waiting list. I'm not saying this, but I do have a lot of clients complaining about waiting lists, whether it's GP or diagnosis for mental health. And some of them are saying it's taking around from 6 to 12 weeks, which is 3 months.
Yeah.
And that's a short waiting time. And that's that's no good to man nor beast. I'm sure we'd agree. And with the stresses, the modern stresses that are affecting all of us, I think one of the biggest stresses that we can see, or stressors rather, is the cost of living.
Yeah.
You know, and we mentioned this earlier, didn't we, about you know, taking a family of 4 to McDonald's. I mean, Sally, do you eat McDonald's?
I can't say that I do. Do you know what? I feel really sick very quickly when I've eaten it in the past, and then I'm hungry after about an hour. So it's like a really weird. So I just don't. No, I can't say that I do.
And no offense, McDonald's, I'm the same. It's a swear word in my house, I'm afraid. And you could say how much it costs to get those meals for those people. You know, I think I worked out you could make a chili con carne for around 8 to 9 people, depending on portion size, for maybe pushing £15. But the difference is, when you compare and contrast similarities and differences, the only similarity is calories in my mind, because the difference is McDonald's possibly is empty calories. You know, the chili con carne, is going to be more nutritious depending what you put into it. You know, and then again, if you've made 8 to 9 meals, if you're savvy, you're going to freeze maybe 4 of them, so you've got 4 further meals in the future. And that's going to save on the gas. That's going to save on the cooking all the time. Because I think that's a big one. Would you agree? Preparation for food. What do you think?
Yeah, absolutely. And I think we can't underestimate the relationship between physical and mental health. They're one and the same thing. So if we think about how do we look after our mental health, how we nourish our bodies through the food that we eat and keeping hydrated and looking after sleep and, you know, getting the fresh air and all of that kind of stuff. You know, our physical health and mental health are pretty much one and the same thing. And I think there are so many processed foods that people might be consuming in fast food restaurants, but equally buying in the home, you know, high sugar food. And ultimately that's, I mean, whilst you might get the sugar high, actually what it does, it's taking away from your body because it's not actually nourishing. So your body ends up working harder to try and process those. That's taking away from your brain and all of that kind of, and your brain functioning. So it's I think it's a tricky one because people, you know, the fast pace of life, people are like, oh, do I have really time to invest, you know, half an hour to an hour cooking a meal, or should I just get a quick McDonald's as well? So it's really tough one. It
is. And I think you're right, though. We picked up on the pace of life. You know, why are people, no offense, eating too quickly, talking too quickly? I mean, have you seen people shopping? They're Usain bolting it down the streets. I mean, I don't understand it. The driving definitely too fast. You know, the cooking too fast. We just said, you know, they're not doing the preparation. So I don't understand, you know, this has been going on for many, many years now, that people are just racing along. They're not even relaxed. You know, I've just come back from abroad, went to Malaysia, Thailand. I couldn't believe it. It was 38 degrees and families were basically sprinting to the beach. I thought a holiday was there to relax and slow down. You know, I've got an excuse for my business, hypnotherapy, hypnosis. You know, my business is a slow business. And again, with your business, training people, we've got to have effective communication. And that's another one that's suffered, I think. People haven't got time to talk to family members. What do you think of that, Sally?
You're totally right. We do need to slow right down to have good connections with people, to feel physically and mentally well. And I think we are just speeding up the pace of life. You know, we've got to work fast, we've got to work harder because there is pressure, there is stress, there's high workloads. And, you know, when it comes to work stress, this high workload is one of the biggest stress factors that people are facing. Job insecurity as well. Well, if I've got job insecurity, I'm going to be seen to be working the hardest, working the longest. I'm adding the most value to the organization. And I think that just creeps over into then our personal lives. Even if we're feeling exhausted, we just push and push and push our bodies and our minds. And then we are putting ourselves more at risk of developing that poor mental health. I think people are less mindful now. I think we forget to slow down because life is so busy and we get caught up in it because we've got pushes and pulls, stress and strains. We've got work, we've got home, we've got families and kids and elderly parents, and we compare ourselves and our lives to other people. So, you know, their life looks better than mine, so we've got to have the nice holiday as well. And I think you know, so many people are talking about this kind of mental health pandemic, but I think we are just responding to society in a very human way. We are more worried, stressed. We, you know, money and mental health, there's such a huge relationship with that, and we do want the quick wins sometimes. I just want something convenient. I just want something quick, so I don't have to worry about it. So yeah, I think it's hugely challenging.
And I think the challenges are there to be overcome. You know, we can overcome them by educating people, whether that's the culinary skills, you know, whether that's, I think we spoke about this before, getting males or females, either gender, you know, we want to stop all suicide. We want to help, support people. You know, we spoke about it before. It's better to express rather than suppress.
Yeah.
You know, just say, you know, Dominic and Sally told you to do it, to ring up your friend, even if you feel silly. You know, it's better to express how you feel, your emotions, you know, and get some support, just a listening ear.
Yeah.
You know, whether it's family or friends. And we both encourage that, don't we? You know, we want people to divulge the information to friends and family, or even work colleagues.
Yeah.
You know, at the end of the day, yes, we're both professionals. You could say with a trained ear, but it doesn't stop anybody from listening to their problem and helping them. Even a manager at work, you know, can hear a member of staff that's pretty low because maybe of a home situation. But you know, if you've got poor mental health at home, that reflects at work, and poor mental health at work reflects at home. You know, I'm sure you encounter that a lot. Do you encounter that, Sally, sometimes?
Yeah, 100%. You know, where people have shared with me, oh, nothing's changed at work, but I feel I can't manage. But then I recognise, oh, actually, it's the stuff going on at home that's impacting me at work, and that's why I feel a bit more stressed and pressurised, and like I can't cope with my usual workload. And I think, you know, we have our phones and we have social media, but I'm the most unsociable when I'm on my phone on social media, because people might, I'm trying to have a conversation. My other half yesterday had a go at me. He's like, Sally, I've asked you the same question 5 times. Phone. And I'm like, I'm so sorry. And I go through these phases of being really disconnected from my phone, and I feel so good for it. And then that habit creeps back in, and then I'm being completely unsociable. No one can communicate. Then there's the frustration, you know, the snappiness and irritability. So we have this kind of social media, but we're feeling disconnected, and those social connections that you've just described, with us, family, friends, colleagues. It could be, you know, a Facebook group. It could be a community group. It could be an online forum where you can access counsellors or listening services. You know, that's what people need for their energy and to feel better is the social connection and with one another. And that's really hard to create sometimes as well. How, you know, I'm a 28-year-old person. I've moved 200 miles away from home. How do I connect with people in my local community?
Your local community,
and it's you know, what groups are there? How can we connect? You know, there's so many. I've got my We Love Reigate group. There's so many people saying on there, oh yeah, you can join our choir. We do on a Wednesday night. You can join this sports team. So it's a great way to be connected. But it's building. We have to be intentional about it. I think that's
definitely.
Gone are the days of the community where everybody knew everyone. Everyone knew, you know, 3 roads away, oh, that's so-and-so's kid. Like, no one knows anyone anymore in community. So I think that's, it poses another challenge, doesn't it?
And you're totally right with the social media, because, again, we're scrolling on the phones. You see couples in restaurants, head down, looking at the phone. They're not even making eye contact. There's a fantastic book out there called Children Under Siege by Joel Backham, who's a professional lawyer. And he talks about the demise of children's brains, unfortunately, because of what we're talking on now, iPhone, iPad. And that's the problem. I feel sorry for young mums, young dads, because that's the theme, isn't it? They give the youngster an iPhone or an iPad. So this actual book says it's destroying the prefrontal cortex, all the learning, the rationalization, you know, all the imagination, which does run our life. So it's detriment to our health. And we mentioned this before. I think it was Dr. Tara Swartz. Our viewers or listeners can look her up. I think she was one of the first ones who quoted a phrase called tech apnea, which basically means we think we're relaxing on the phone, scrolling, la-di-da, but Okay, like smokers who think they're relaxing, you're actually poisoning yourself. She states that you're holding your breath, waiting for a like or a dislike. You don't like that person. We've all heard of the phrase clickbait. You know, you've got to be very careful what you comment on social media. You know, people take it the wrong way. You know, there's a lot going on. Body image for young women and young men. You know, that's quite a big problem. You know, it could be phones in schools. Are they listening to the teacher, the lecturer? You know, it's distractions, which is unfortunate. And again, you hit the nail on the head with couples or families. You know, people sitting around the family table. People don't sit at the table anymore. They're on the phone. So this connection, this communication, it's being eroded. You know, youngsters, you know, they may look taller. You know, I'm a shorty. They may look bigger. You know, look you know, full of nutrition. But are they? You know, my sport was rugby. I'm a bit of a rugby geek. Oh, he or she'd be a good second rower. You know, the 6 foot, you know, 6.5 foot or whatever. But would they? Because if they've been eating a certain brand of food we mentioned earlier for 15 years, they haven't been getting the nutrition. You know, if they haven't been focusing on what people are saying to them in the class, then they're not taking that information. And here's the thing, I think it was true of goldfish memory. You know, they have a 5 to 9 second memory. They can't focus. You know, so that's affecting communities, and I think that's a big one. You know, even a restaurant I saw the other day would knock, I think, 15-20% off the bill if you put your phone in when you went in. That's a great idea.
Love that.
You know? Yeah, so couples start talking again. I mean, especially if you've been in a relationship for a number of years.
Yeah.
Worst thing in the world to bring the phone out, and you're looking at the phone. You know, and it's going off as well. You know, it's pinging it, and you're at home. And I think that's part of the problem that COVID brought us all, because there were some positives which we may go into if we've got time, but people began to work from home, didn't they? But the problem is there's no boundaries. Because now your office that you drove 10-20 miles away is now in your living room. Or, God forbid, I say to my clients, your office is in your bedroom. So how do you think you're going to get a great night's sleep? You know, you know, I'm sure you'd mention that about sleep, wouldn't you, Sally?
Yeah, I mean, that was hugely problematic. You know, I delivered a number of learning sessions for clients about how do you manage boundaries, because essentially you've been thrown into a completely different way of working. And, you know, people talk about, oh, we're all working from home now. And I was kind of like, no, you're working remotely whilst trying to live through a pandemic. I think those are psychologically two very different things, because we weren't necessarily, I mean, there were some organisations that were already remote, so it didn't make a huge difference. But how do people manage those boundaries of, this is my workspace, this is my personal space, when I live in a house share with 5 random people, the only place I can work from is actually my bed. So I'm really blurred. I don't have that 20-minute buffer time between work and home, and, you know, I'm brushing my teeth and then jumping straight on the laptop. Like there was no kind of buffer time. So yes, a number of people I spoke to about having to be purposeful and take action and be really intentional, and, you know, pop it in your diary, that 20-minute, you know, brush my teeth and then I'm going to take a 20-minute walk, and then I'm going to go and start working, or whatever that might be, just to try to build that in. But that's really hard when, again, we've got high workloads and we're pushed to overwork, and people are being made redundant, and you've got to pick up everything else. Hugely challenging.
They're great points, because, again, what you said, there's no division, you know, between work-life balance, which is a problem. I looked at a book, we did mention it, we discussed it a little bit, didn't we? Status Syndrome by Professor Michael Marmot, if people want to look at this. Fantastic book talking about status in this country and abroad. He talks about, one thing I took away from it, a model called high demand, low control, which is what you're talking about. We're under so many stresses, but we've hardly got any control, which is really the definition of stress, isn't it? You know, we're out of control. There's no autonomy, and that's a problem. And because all of this is going on, that then will make people more anxious. If you don't feel good about yourself, I know we've met for coffee before and that sort of thing, but if you don't feel good about yourself, you may not want to step outside of your house to meet people. So it's a catch-22. We need social cohesion. We need to meet people, as we mentioned before about communities. But the problem is, if you don't feel like it, how are you going to step forward and do that? And that's about self-esteem. And we're both trying to raise people's self-esteem. I mean, sorry, I'm going to rewind a little bit to cost of living. I walked in a Tesco near Solihull the other day. I like is it Uncle Ben's rice? Stick it in the microwave. Sorry, that's the only microwaving stuff I do. And it used to be £1. It's now £1.40. I did sit at the back of the maths class, but that's a huge percentage.
Yeah, it is. Even a garlic bulb. When I'm doing my food shop, I can't believe how much a garlic bulb is. It used to be 50p. Very quickly, within a couple of weeks, it went to 65p. I've got no idea what it is now, but within a couple of weeks, it's gone up something like 15%. And you're just like, even olive oil now, you're looking at 8-9 quid for olive oil, and
crikey,
it's unbelievable. Yeah.
And I think just on that one for a moment, if we can, for a minute or two, because we're both foodies, aren't we? What about when people are telling us to have low fat this, low salt this, low that? What do you think of that? We should get the butter, the proper butter? Would you agree?
I always buy proper butter.
Yeah.
I just think about nourishment.
Absolutely.
Nourishment. I think there's a lot about out-of-date research that tells you that fat is bad for you, and our brains and our bodies are made of water and fat and meat. So I'm kind of a bit like, and the thing is with low fat, they just stick a load of sugar in anyway, which is helpful as well. So it's less of one thing, but more of another that could be more unhelpful for your body as well.
Definitely. So I think we need to educate again with that. We'll have to do maybe another podcast on culinary skills, because as you said, what you eat, you are what you eat, aren't you?
Yeah, what you eat, it has a huge impact on how you feel every day, right? So
definitely. And have you ever noticed, I have, unfortunately, the school children or school kids, terminology, going to school with a can of Monster. And I'm like, is that going to work?
I think maybe we should have another conversation about caffeine.
We'll go into that, I think, on the next one. But I think we could possibly today leave a couple of tips. What do you think for our viewers?
Think so. I think let's close on optimism. We've probably been going about 20 minutes now already. So and lots of really good discussion, but let's close on optimism. So what are your thoughts? If people are going to take 2 takeaways from this discussion on how they can maybe support themselves or others, what would those 2 things be?
I think they've got to be very careful what they're eating. Shop around, don't buy processed food so much. 80% healthy, 20% gunk junk, as my nan used to say. And reduce your caffeine, because that one will send your adrenaline sky high, and you will have a sleep disorder if you drink caffeine after midday, which we'll go into in more detail another time.
Fab. So the physical health side of things very much, and for me the social side of things, about the social connection, talking to people, asking for help. If you don't feel connected to people, a helpline, an organization, a chat group or something like that. And and you've mentioned it already, when you don't feel like you want to reach out for people, I think it's about everybody else just recognizing, I've not heard from so and so in a while, I'm going to talk to them, and being proactive that way, because if someone doesn't have the energy to do it, we can do that for them and connecting.
Definitely provide that support.
Amazing. Cheers. Thank you so much, Dominic. Great to speak with you. I look forward
Thank you, Sally.
Cheers.